Fill your thirst beside the river. Wash the journey from your hands. Feel the comfort flow inside you.
That's nice to know you.
Hello, welcome to Healing Outside the Box. This is our 125th show. And my name is Rosemary Lachance, and I'm an energy healer and a spiritual therapist. And I am a co-host. My other co-host is not here tonight. She had some problems, but she'll be back next time. And we're dedicated. We are co-hosts for this thought-provoking series and are dedicated to providing you with food for thought information and answers to all modalities of alternative healing, spiritual development, animal welfare, environmental concerns, and so much more in the form of our guest speakers who are experts in their fields. If you know of any subjects you would like us to discuss, or if you know of anyone you think would make an interesting guest, please let us know. And please like us on Facebook under Healing Outside the Box, where you can learn about and see pictures of some of our past guests and ask questions or leave a comment. Enjoy the show. Okay. The title of our show tonight is Arthritis. And we have with us tonight two wonderful, wonderful naturopathic doctors, Dr. James Sensenig and his associate, Aviva, Dr. Aviva Wertkin. Welcome.
Nice to be here. Thank you.
Thank you.
Thank you so much for coming. All right, let me give you a little bit of information about them. Dr. Sensenig has been practicing naturopathic medicine for nearly 30 years and is well known for helping thousands of people regain their health. Dr. Sensenig sees patients with complaints of all kinds and is particularly interested in the treatment of digestive diseases, headaches, migraine, joint and muscle complaints, and chronic fatigue. He also sees children with health problems ranging from asthma and eczema to developmental delays and autism. Dr. Sensenig graduated from the National College of Naturopathic Medicine in Portland, Oregon, where he later served as Dean of Education. He was the founding president of the American Association of Naturopathic Physicians, the chairman of its Government Affairs Committee for a decade, and the founding dean of the College of Naturopathic Medicine at the University of Bridgeport. He also has consulted for a number of government agencies, insurance companies, colleges, and natural products companies. He's on the faculty of the Southwest College of Naturopathic Medicine in Tempe, Arizona, and the University of Bridgeport College of Naturopathic Medicine. And Dr. Aviva Wertkin earned her doctorate of naturopathic medicine at Southwest College of Naturopathic Medicine. She has conducted research at the National Center for Complementary and Alternative Medicine and at the National Institute of Mental Health in Bethesda, Maryland, resulting in several publications. She completed a 2-year residency in naturopathic family medicine and enjoys providing naturopathic care for all ages and all health concerns. She is Dan? Dan? Okay. Dan certified. What does that mean?
It's Defeat Autism Now.
Ah, okay. I learned something new tonight, and I guess you all did out there too. She's Dan certified and a level 2 ART practitioner. ART.
Autonomic Response Testing.
Wow, okay. She has a special interest in neuroendocrine, immune, and digestive conditions, including chronic pain and fatigue. Dr. Wertkin uses classical naturopathic therapies along with acupuncture in her practice and is mindful of the psycho-spiritual aspects of illness, which is so important. She is currently on the faculty at the University of Bridgeport Naturopathic Medical School and a board member for the Connecticut Association of Naturopathic Physicians. I got through all that.
Well, there's the whole show right there.
Okay, it was nice, folks. We'll see you next week. Okay, so the first question I'm going to ask is, what is arthritis? Because I have been hearing, I didn't realize that so many people have arthritis. So many people. Everyone I talked to had a hip replacement, a knee replacement, a shoulder replacement, you name it. And they're in pain, and they don't know what to do, and so
It's so true that it is so common, and so many people are suffering from Well, for many people, they may think they have arthritis, but if we just think about classically the term arthritis, there are two main types. There's the osteoarthritis, which many people are familiar with. It's sort of the wear and tear type of arthritis on bones and joints. And then the other more common type is rheumatoid arthritis, which is more of an autoimmune inflammatory response. So those are sort of the two main categories that we would see. But one of the things we really want to talk about with you and with the audience tonight is how there are a lot of things that we call arthritis that are really just symptoms of another problem.
Okay, good. That'll be good. But what is arthritis? I mean, it's autoimmune. Well, you said autoimmune with the rheumatoid, and the osteo one is from what? Just getting older and just. Not necessarily, huh? Because younger people get that too, right?
Right. Well, it's considered a degenerative condition.
Okay.
Where it's, well, the term arthritis is more, it means inflammation of the joints.
Okay.
And the osteoarthritis is really when you start to have a breakdown of the joints and the bones.
Okay.
But that's really just still naming a symptom and not looking at why that's happening for each person.
Yeah, that's the thing. Why does that happen? And do you know that, why it happens?
Yep, well, that's what we want to talk about.
Right, exactly. That's what we're going to talk about tonight.
Yes.
Okay, is it hereditary?
Well, let's go back to the question about what is arthritis, because, you know, when you asked us that question, the way that we're characterizing this in those broad categories are the way conventional medicine would look at it. And you raised this question about if it's normal wear and tear arthritis, like osteoarthritis, how come so many younger people have it? I mean, do they really have the wear and tear?
Right.
Well, that would make you wonder right there whether there's some other things going on. So maybe it's not really wear and tear. We'll come back to that in a minute.
Okay.
But we were talking about this on the way to the studio tonight, and we're kicking around, how do you say, when you ask a naturopathic doctor, what is arthritis? That's like saying, what is food? Food is a very broad category. There's lots of different things that we call food, and they're not all the same. And the same is true with arthritis. Arthritis is a generic term that means inflammation of the joints. It seems these days that people use that term when what they mean is, I have pain in my joints, or pain in my back, or pain in my neck. And there are many times when people are diagnosed with arthritis. Well, if you have neck pain, you must have arthritis. I mean, what do you expect? You're 40 years old. Or whatever it is. You have pain in your knee, it must be arthritis. And it's not truly arthritis in the sense that it's an inflammation of the joint, where there's calcium deposits in the joint causing the inflammation as one possibility. So when you say that you see a whole lot of people these days who are complaining of arthritis, we've taken that term beyond its original meaning. What they're saying is, I hurt. I think that's really what they're saying. I'm in pain.
Yeah.
Right?
Yeah, that plus people who have had this replacements.
Right.
Too,
well, that's a whole other thing.
So both kind.
So in naturopathic medicine, we're not so interested in what you call the symptom, pain or joint pain or arthritis. We're interested in what's contributing to or what's causing that. And that's a different approach. In conventional medicine, if the pain is in the joint, you give the patient something for the pain. Or if there's enough deformity in the joint, you repair or replace the joint.
Right.
But in naturopathic medicine, you're interested in the bigger question of why is this happening and what can be done to reverse that. And that's different for every situation.
Yeah.
I mean, I'm exaggerating a little bit, but there are many, many, many different ways in which we can have joint pain that are different from person to person. For example, when we're teaching this classically, what we'd say, let's say we had 20 people in this room who were complaining of arthritis. And by arthritis, let me say pain in the neck, right? Pain when they turn their head, limited range of motion with a little bit of maybe some bone spurring in their neck. Well, those 20 people are 20 different people. And the contributing factors for one are not exactly the contributing factors for the next. So to say, how do I treat this, depends on the person.
And I think that can be hard sometimes for people to understand, because it's really been ingrained in us to think, what do I take for this problem? Not what's causing the problem. And when people start to look at it differently and start to question why, that's when real healing can occur. But so many people think, well, maybe there's a natural alternative I can take or a natural pain reliever. But naturopathic medicine can go beyond that. It can go beyond a natural pain reliever to really trying to fix the problem.
Right.
Well, also, but back to the question of what might be causing something, maybe you want to share that story that you and I were talking about where someone called you and told you.
Right, so I was just telling him about a patient that I had who she had come in for a completely different condition initially. She came to see me for depression and anxiety, and that was resolved within a couple of months, and then I didn't see her for a while because she was doing well, and then she called me in the office and said, I'm having arthritis, pain, what can I take? And she said, well, I've heard about glucosamine and chondroitin, should I just take that? And so I said, well, I don't know if that's what you need. You know, if you could come into the office, make an appointment, come in so I can get more information and do a physical exam, that will help me really determine what you need. Maybe it is glucosamine and chondroitin, maybe it's something else. And then when she came in and I got all that information, what I found was she actually had misalignment in her joints. That her knee pain and her elbow pain and her back pain were all coming from misalignment. So she had the joints were not lining up properly, causing that kind of pain and stiffness that would appear to be arthritic pain. And so all we did was some physical medicine in the office to realign those joints, and all of her pain was gone.
Oh, physical, you mean like you did something like
a manipulation or adjustment
yes.
To those joints.
That's great. So you do that there too.
Yep.
That's great.
And it was great. And then she left without pain, and I had her come back a week later to check on her and see if we needed to do anything else, and that was it. You know, and that's part of why we try to emphasize the individualized medicine, because if I had just told her over the phone, sure, take that pill, she might still have that pain today and just continue to manage it.
Yeah.
And that kind of thing happens all the time because people don't know. They just know that they're hurting.
Right.
And they just want to get out of pain.
Right. And that's what usually a medical doctor will do, give them something for the pain.
Well, that brings up a really interesting point as well. The thing about, in this case, you have to correct me if I'm wrong, but the way I'm understanding this story is the patient called her and said, I have arthritis, by which she meant I'm in pain, right? But using this generic term. So should I take glucosamine or chondroitin? Because why? Because I've read somewhere that that's helpful for arthritis.
Right.
So it turns out that the cause of the pain is something completely different. But one of the downsides to this, besides the simplicity of just treating symptoms, which is what people are taught to do conventionally, is the corollary to this that sometimes makes me a little angry, can I say that word on TV?
Sure.
Where somebody will take the chondroitin and the glucosamine for their arthritis, and then they get to say, it didn't work. I tried natural medicine, but it didn't work. What they really mean is I tried the wrong thing for the wrong symptoms, and it didn't help me, so your stuff doesn't work.
Right, exactly.
So, and that happens a lot. Because in conventional medicine, one is anxious to, I should say eager to, name the symptoms and then treat the symptoms. So this conversation applies equally well to problems that are outside of what we're talking about tonight.
Yeah, what they usually do is give something for pain.
Well, and the difference is that what we'd like to think, and nobody has all the answers, but what we'd like to think that we're looking for in naturopathic medicine is rather than treating the pain, let's find out why you have pain.
Exactly. That is logic, common sense. It just is.
It would seem so, right?
It is. It's simple logic.
Right. Yeah, and the other way makes no sense to me, and I see this all the time where someone says, you know, I have knee pain, I went to the doctor, I had an x-ray, and it shows arthritis, so now I'm taking a pain reliever. And then that pain reliever may give some short-term benefit because it's reducing some inflammation and it's masking the pain, but now it's causing damage to your stomach, it's causing damage to your liver, and then people have to go on medications to protect their stomach, like any of the over-the-counter prescription acid blockers.
Right.
Now, if that patient really has a degenerative process, it's very likely that they do not have proper absorption of the minerals that their body needs. Now, on top of that, they're going on a medication that shuts off their stomach acid, so any of those acid blockers to protect the stomach is shutting off stomach acid, further worsening the body's inability to absorb the nutrients it needs. So it really ends up that treatment speeds up the problem, further worsening the pain, and then people know from conventional medicine that it's an inevitable worsening that ultimately results in surgery. You know, and so you're managing the pain as you get progressively worse.
I guess that just, it's over the years of being handled that way by allopathic doctors. You know, I mean, I have been in this day and age in a store, in line in the grocery store, and mentioned something about, I think I mentioned you or something, naturopathic medicine. What's naturopathic medicine? What is that? You know, I can't believe in this day and age people haven't heard about that, you know. But it's, like, when it comes to common sense. So,
well, that's why we're here, to start helping get the word out and let people know that there are other options that are available, things that are very safe and very effective that people don't know about. But it goes beyond just replacing a drug with a natural supplement. It's really about knowing exactly what somebody needs for their body.
So that brings up two of the topics. I'm really glad that you said what you just said. Naturopathic medicine is not simply replacing drugs with something natural. This is not, can I say this on the air? This is not Dr. Oz. This is not dirty words. This is not Dr. Oz's medicine. This is not Dr. Weil's medicine. We're not looking to simply use things that help you lose weight or help you do this or help you do that by treating the symptoms. A good naturopathic doctor is trying to correct the underlying imbalances that led to the problem in the first place.
Right.
Now you go back to arthritis. What are those? Well, there's the obvious wear and tear musculoskeletal side of this that we've already alluded to. But the other thing that Dr. Wertkin alluded to is if you have degeneration, which in the language of naturopathic medicine might include arthritis that has calcium or other minerals in the joints, then there's something going on with your mineral metabolism. Your minerals are out of balance. Usually the minerals are deficient, and the body is moving them around from one place to another to make up for those deficiencies, and some of that ends up getting stuck, you might say, in soft tissue. And a classic example here is osteoporosis. When someone doesn't, see, the medical profession would have you believe that osteoporosis is some kind of a disease of the bones. It is nothing of the kind. It's an imbalance in the body, in mineral metabolism, where in the wisdom of the body, or in the body's wisdom, maybe I should say, it borrows the calcium from the bones to make up for what's deficit or deficient in the bloodstream. You can't function without calcium. Your muscles contract and relax with calcium. Your nerves work with calcium. Your heartbeat depends on calcium. So if you don't have enough calcium, your body's going to get it where it can. And where can it get it without threatening your life? In your bones. So the body's moving the calcium purposefully. This is not something breaking down. This is not something gone wrong. This is everything gone right in order to live. The body borrows the calcium from the bones and moves it into the circulation. That's osteoporosis. But what does that have to do with arthritis or degeneration? Well, you start moving that calcium around. Some of that gets deposited in the joints or the soft tissue or the muscles, or for that matter, the gallbladder or the kidneys, and then we get kidney stones, gallstones, but joint pain. So if there's a mineral deficiency or a mineral imbalance, that's one possibility for stiffness in the joints, tight muscles, and so on and so forth. So there's part of your answer to why is there so much of it. We're living at a time where our food does not supply the nutrients we need, especially the minerals.
Right.
So if you're witnessing younger and younger people complaining about arthritis, then I would tell you that the corollary to that is we have more and more nutritional deficiencies.
I don't think you should have knee replacements at 40 years old.
No,
And I've heard that.
And I just want to add to one thing that you were saying as well, because I think this is really important for people to understand. When people, let's say they decide, okay, I know I have arthritis, I've heard that's related to calcium, they go to Costco or CVS and they get some generic cheap calcium tablet, and it's a big calcium tablet all on its own that the body has a really hard time breaking down and absorbing. And if you're deficient, people seem to equate calcium with minerals as if it's the only mineral.
Right.
But the body needs a lot of other minerals, especially to help absorb the calcium and to help just absorb into the joints as well. So a lot of people are misinformed and they think they're getting the benefit when in fact they're really missing the point with their minerals.
I'm glad you brought that up, because when I had my health food store, and that was back in the 90s, my competition wasn't another health food store because there wasn't anyone around. It was drugstores and supermarkets. People would go and buy the cheap, generic brands of vitamins, which didn't do anything for them because of the money and the price, and because you know it was also handy. I'm right there, and yeah, that's so true. Taking the wrong supplement,
and it's just a waste of money.
Exactly,
it's a complete waste.
That's really an important point that we should emphasize. You would think that calcium is calcium is calcium, or zinc is zinc is zinc, or fish oil is fish oil is fish oil.
Not.
That has not been our experience in clinical practice. When we use the right stuff in the right combination at the right, or in the right form, and we're talking about high-end pharmaceutical grade products, we get good clinical results. When those are replaced by the over-the-counter cheapo stuff that you can buy 20 on sale, you know, for a couple of bucks or whatever it is. I've seen this over and over and over again, where the symptoms that are well treated or the problem that is well reversed with the right nutrients suddenly return again when somebody goes to the cheaper. They try to save a few bucks, and who can blame anybody for saving a few bucks? But you're not getting the same thing. You're not getting the same quality. No. And that sounds like it was your personal experience as well at the store.
This is what happened. And when people finally did come and I told them, and then they knew, and then they were educated and they were able to do that, you know. But
so if I may, I'll give you another example here, which can open up our discussion even a little bit more. I had a young girl. She's probably, if I remember correctly, probably 11 or 12 years old, who was brought in because she had been diagnosed with rheumatoid arthritis. Ooh. And she was on immunosuppressive drugs for this. Now, this is because the assumption in conventional medicine is that if you have rheumatoid arthritis, then it's an autoimmune disease. And the conventional approach to an autoimmune disease, maybe we should back up. An autoimmune means that your immune system is attacking the joints. And so she was diagnosed with rheumatoid arthritis. The assumption is that the immune system is attacking her joints. So they put her on a medicine to suppress or shut down the immune system. After physical medicine, manipulation of the joints like we talked about before, I should tell you, I should back up. This young lady was diagnosed with this problem on the basis of having back pain when she was physically active. That was the basis.
Okay.
Okay? Manipulation of her spine in places that were necessarily out of line, a little bit of mineral supplementation specific for her case, and the elimination of one food that we found her to be reactive to or sensitive to, which in her case I think was dairy products. Symptoms are gone. There was no rheumatoid. See, from our point of view, that's not rheumatoid arthritis. That's a mineral deficiency, a spinal misalignment, and a food sensitivity, all together in the same person creates the perfect storm for muscle pain in the back. But if you're only looking at the muscle pain, then you're going to treat the muscle pain. If you're looking at the patient, you're going to look at the factors that are creating the perfect storm of conditions that allowed that to happen in the first place.
That's right. So you get the right medicine, you find out what the problem is, and then of course I'm sure you tell them to eat right, eat healthy and so forth. Makes a big difference. The whole person, treat everything.
This is also a case that obviously the audience is paying attention here and knows that this is a case that shows you that here's somebody who, if you were in casual conversation with her or her family, you would think this little girl has arthritis. One of those many people that you've heard about who has arthritis. Did she have arthritis or did she not have arthritis? Because when the underlying factors are corrected, there is no arthritis.
So that brought up another interesting point I'd like to talk a little bit more about, which is how diet and nutrition can play a role in arthritis.
Yeah, I was going to ask you that question. How does diet affect
whether it's we're looking at osteoarthritis or rheumatoid arthritis or just, you know, people having joint pain in general, there are many different ways people can react to foods. One way is hidden or delayed food sensitivities, and we'll often test for that with a blood test in our office to check people, and that can create chronic inflammation in the body and joint pain, and that can be anything from dairy products to gluten, certain nuts, eggs, yeast, all kinds, you know, sometimes fruits, vegetables show up, things that you wouldn't expect, which is why we test. But I would say some of the most common foods I see are sugar is a really big one. And a lot of people have these sort of secret sugar addictions that don't even realize that they have sugar addictions. And when they finally wean themselves off, you know, and we help them do it, wean them off sugar, they find all of their joint pain and stiffness goes away. It's incredible. I've also commonly seen the nightshade vegetables. That's your peppers, tomatoes, eggplant, potatoes. That family can frequently cause joint pain, stiffness, swelling.
I always wondered why. I've heard that, and I wondered why. Because they're great vegetables.
They are, and a lot of people love them.
Yeah.
And it tends to be people's sort of favorite food or the thing they eat every day. And then when they finally get it out of their system, they're amazed at how good they feel. You know, and then you can make that decision. Okay, I might end up having that tomato and know that tomorrow will be a little stiff and the rest of the week I won't. Yeah. You know, once you know what the culprits are,
then
you
don't eat
decide.
it so frequently, you know, you can have it. Yeah. Nothing should be eaten constantly anyway. Right. It will cause a problem like that.
That's an interesting axiom too in food sensitivity testing. People, this is not a hard and fast rule, but people tend to crave the very things that are no good for them.
Yeah.
You know? So when you test a youngster and you find out that their immune system is reacting to dairy products, the first thing mom's going to say is, oh my, that's his favorite food. Milk, ice cream, yogurt, cheese, and so on, or whatever. So it's an interesting guideline, and particularly with people with arthritis who are listening and want to do some self-care. If there's something you're eating a lot of, cut it out for 30, 40 days and see if it makes a difference. Then put it back in your diet. See what happens.
Right, that's true.
Oh, but keep this in mind. You can be reactive to more than one food.
Right.
So if you take the dairy products, to use that example, out of your diet and you're still eating 2 or 3 other things that you're sensitive to, it's probably not going to make a big difference.
That's why you need to be tested. You really need to be tested.
Now, of course, there's other causes for joint pain as well. And commonly, those include infectious diseases, especially all the tick-borne diseases. Lyme disease, babesiosis, Bartonella, ehrlichiosis, now called anaplasma, and Rocky Mountain spotted fever. So there are, I think, there are a lot of people walking around who are being treated for joint pain or arthritis who have an underlying infectious problem as well. And then you were talking about digestive system earlier, about that as a cause too. You want to talk about that?
Sure. Well, I just want to add one thing to the part you're saying about infectious disease, and one of the reasons why it's going undiagnosed for a lot of people is that the tests done to diagnose these diseases are very inaccurate, and there are a lot of false negatives, and then when you don't have those answers, if you're fortunate to have a doctor test you for that, well then it comes back negative, and then your next resort is to go on pain medication. Yeah. And it just gets missed.
Yeah, we had a show on that, you know, and they talked about that in there, and there's an author that said that if you can't get the test you want, to get in touch with him and to tell you where you can get the deeper tests where they can really find it. That's a big problem. We had a woman whose mother was dying from that problem, and she told her whole story and what she did and how she got it. So yeah, that's very important. I'm glad you brought that up.
And that's I'm sorry.
No. I would say there's one more thing that will cause joint pain, and I found that out myself. When you become dehydrated, if I become dehydrated, my joints ache. Oh my God. And you know, you have to drink a lot of water, but sometimes you drink the water, goes in and comes out, and goes in and comes out. So you have to find a way to stay hydrated.
Yep. I think that is such an important point.
Yeah.
So many people come in with chronic pain and their muscles are tight and their joints hurt and everything is stiff because they're so dehydrated. And the quality of water makes all the difference. So just like you were saying, you can drink and it goes right through you, that means you're not absorbing it.
Right.
That's not a good quality water. And I am astounded by how many people I ask about where their water's coming from, and they're drinking tap water.
Ooh,
yeah,
tap water.
Yeah.
No.
And you know, or people say, I don't drink water because it doesn't taste good.
Yeah.
Well, why do you think it doesn't taste good?
Fluoride. Ooh.
But
Germs.
it seems that the quality of water, like everything else, seems to be diminishing, and the quality really makes a big difference. So one suggestion that I've been telling people is to add some electrolytes or some trace mineral drops, which helps the pH of the water, and then it's better absorbed. And you can feel it. You can actually feel that your cells are getting more saturated with the water, and it doesn't go right through you. People also say they drink water and they feel bloated right after they drink it. It's the same thing.
Really?
They're not, yep, because you're not properly absorbing it. So many people are dehydrated. If everybody just got the message to properly hydrate, they would feel so much better. Energy would be better. Pain could go away. It's extraordinary.
I know. That's. I just found out about that. You know, I realized it because it happened to me. Towards the end of the day, getting dehydrated and hurting, and I'm going, oh my God, I must have arthritis everywhere.
Right.
You know?
Yeah.
And then I wake up in the morning, and it doesn't hurt. And I'm going, well, that's not right.
Yep.
You know, and then
Yeah,
so,
and then people also just forget to drink. People say they're not thirsty, and they forget to drink, and it's hugely important. It's one of those basic, simple things that gets easily forgotten.
I know. I read an article once where it says only drink when you're thirsty. I don't think so.
No.
Well,
And I don't think it's also, may I say this, excuse me, an idea to put in diet flavoring into your water, because that dries you out. To me it does, artificial sweeteners.
Oh, yeah, that's okay.
Okay?
Yeah.
That dries you out. You totally cancel. You might as well not drink the water. And they use that a lot.
there's an interesting book whose title I can't recall, but it's something like Your Body's Many Cries for Water.
Oh, I haven't heard of that.
And I may be wrong about it, but something like that. And it goes through all of the symptoms that can be alleviated by just drinking enough water. And on the question of thirst, if you learn not to drink, then you don't know when you're thirsty. Or to say it a different way, if you're well hydrated, you will sense when you're less hydrated. So that's what thirst is. So people who don't drink enough liquids have trained themselves to learn with less, to live with less liquid.
You're
so
right.
obviously they're not hungry or not thirsty.
You're absolutely right. I was going to say, a nice fresh lemon squeeze in there, or mix it with some cranberry juice, which would also be good for your bladder and all that stuff, just for a little flavor, and drink the water. I wanted to make this point about what you just said.
The many symptoms?
The many symptoms of, I hate when that happens. It'll come back to me.
It'll come back to you.
And I'll bring it up.
You had asked me about the digestive component, and I think that's an important thing to bring up too, because people might wonder what digestion has to do with arthritis and pain. And this is one of the benefits of being a naturopathic doctor, because we have the time to get the whole story of what's going on, understand each organ system in the body, and put the pieces together. So well, there's a lot of things with digestion, but there are a couple things I thought might be beneficial for people to understand. Number one, if you're chronically constipated, you have a lot of autotoxicity in the body, meaning if you're not having a bowel movement that's complete every single day, you're constipated. That will actually create a lot of muscle spasm and tension and tightness and aching. And as people start eliminating more regularly in a very healthy corrective way, not just laxatives, but in a different way, they will feel the pain just start to drain right out of their joints. And I've also tested a lot of patients and found parasites. And when we treat the parasites, all of their joint pain goes away. Even when it looks like it's rheumatoid arthritis or osteoarthritis, it's extraordinary. And so again, it's just another way of understanding that we have to look at each person and get the whole picture to understand what's causing their symptoms.
I'll bet our audience didn't realize there were so many things that could cause joint pain
Well,
before this show.
And there you go again with this general difference between the conventional way that medicine is practiced and naturopathic medicine. In conventional medicine, everything's in a separate box. They even have different doctors for each box. They got one for your joints.
Exactly.
They got one for your muscles. They got one for your nerves. They got one for your spine. There's one for your headaches. There's one for women. There's one for men. There's one for your digestion, and so on and so forth. But it's all the same person, and everything is related to everything. So joint pain is not a dis-ease. Arthritis is not a dis-ease. It's a manifestation of or a symptom of something else. And the question is, what is that something else? And that's where you need to work with somebody who knows how to figure that out.
Exactly.
I'd also like to make the point, because somebody might be saying to themselves, well, I've had an x-ray and it shows that I have degeneration in my spine or in my knee, so I know that I have arthritis. Well, you can x-ray most of the population and you're going to find some level of degeneration. It doesn't mean that's the source of the pain. And just as an example, I had a patient who was having knee pain, and she was kind of limping around and it really hurt, so she went to her orthopedist and they took an x-ray and said, you have osteoarthritis, take some Aleve. So she was taking the Aleve and it diminished some of the pain, but she was still limping around when she came in. And when I examined her further, it turned out that her IT band, the iliotibial band that goes along the side of the foot, that was all in spasm. And the ligaments by her knee were in spasm and inflamed. And so just by doing some body work and relaxing that with some supplements, all of her pain was gone. So the
And she still had degeneration in her knee.
Right. So that clearly wasn't the source of her pain. That's something still to look at and correct. But I didn't want to just treat that diagnosis. I'm treating what's actually causing the pain for her.
Exactly.
But I know that our audience is also wondering about, what if I actually have arthritis in my knees?
Right.
Because I get to the, people say, what if now I'm bone on bone? I'm sure you can't do anything, right? You can't reverse it, I need surgery.
Yeah.
And that's when we say, there is something that can be done, and it can be reversed. And I know
Really?
that we've both seen patients who've come in, even with canes, who are about to get surgery because it's bone on bone, but with the proper approach, with the proper dietary changes and supplementation, most frequently, it can be reversed.
Really?
You can regrow the cartilage and the joints. And I think that's a really wonderful thing to let people know is a possibility.
Yeah, that's a great thing to know. I didn't know that. My goodness, because I suffered through that and didn't know that for all that time. Didn't realize it. And I came to you, but you didn't know what I had at the time, and I couldn't do the testing and so forth and so on. And by the time I got to the doctor, it was too late. I had to have that done. But
So with respect to what Dr. Wertkin just said, if you think about it this way, if your body can go in one direction where things are breaking down, we think of it as things are out of balance. It can go in the other direction. It can go in the direction of reestablishing that balance. Or if we want to be a little more clear about it, if you can break down, why can't you repair?
yeah, that's true.
I mean, it's that simple. When you cut your finger on a knife in the kitchen sink, in a week or so, that's completely healed. So your body knows how to heal your skin, but it doesn't know how to heal your knees. Your body knows how to heal the cut on your hand, but it doesn't know how to heal the joints. How does that work?
Well, they're going to probably say, well, my old bones, don't have enough of this or enough
But what
of that.
happens to old skin?
I know. That's
Old
what
skin
I'm
still
saying.
heals.
Yeah.
But you have to have the right, for the body to do what it knows how to do, it has to have the right tools to do the job.
Yeah, that's true.
And those are the nutrients that are required for healing. So that's where it takes somebody who can help you sort that through.
That's a wonderful thing for people to know, that you could do something like that. What about, I've also heard that if you have trauma, like say somebody falls on their hip and they have severe trauma to it, that over time arthritis can grow in that spot. Have you heard that? That's what I've heard.
Well, absolutely, and we see
trauma.
that, and we see that a lot. However, you have to sort that out, what the trauma was, because what happens a lot with, now if we talk about trauma to a joint without fracturing a joint, let's say, we have trauma to the joint, often what happens is that joint is now painful enough or traumatized enough so it doesn't move fully, the range of motion has been decreased. A perfect example of this would be something like whiplash. Someone's in a car accident, we see this all the time. You see somebody who was in a car accident 20 years ago. They don't think that they had any symptoms from it at the time. they don't remember anything.
Yeah.
But there's been a little bit of soft tissue damage, and there's been a little bit of decrease in the range of motion, which is actually protective. The body's protecting, in this case, your body's protecting your neck from further pain by keeping you from moving it, or moving it less, right?
Right.
Well, less and less movement over time results in more and more stiffness and more degeneration. Because part of preventing the degeneration is full motion or full range of motion. So when you have degenerative disease or degenerative disc disease causing what looks like restricted motion, the question is which is the chicken and which is the egg, right? So sometimes, and we should add that, you know, not everybody can completely recover or completely heal. It depends on how much damage is done.
Right.
But often with a degenerative joint that's been traumatized, rehabilitation of that joint allows you to have less inflammation and possibly full range of motion and no pain. Another example that just comes to mind as you're saying this is the number of people that I see with rotator cuff, so-called rotator cuff injuries, or shoulder arthritis in their shoulder.
Right.
Well, the shoulder is a very complicated joint. It's the only one that's supposed to move in all directions, so we can swing through the trees or whatever. Most of our joints move in one direction, right? This one moves in all directions. It's a very complicated joint. So it doesn't take much for the shoulder joint to be painful or seemingly arthritic when there's ribs out of place, scapula out, what's the common name for scapula? I can't even think of this. When the scapula's out of place, when the ribs are out of place, when the collarbone's out of place, these all help to form the relationship around the shoulder. So muscle spasms and so on. So people are told they have arthritis in their shoulder, and it may be nothing more than these physical medicine problems. That's a frequently traumatized joint, which is what made me think of it.
Yeah, I know, because I have soreness in my shoulders. I do,
Yep.
and I'm thinking arthritis again, you know. But
Sure.
it could be these other things, what you said, you know. And it's worth it for people to come and find out.
Well, and so many people will say, you know, my shoulder hurts, and then you just put your hands on them and you feel what's happening with the muscles, and they're so tight. And people don't even realize how tight their muscles are because they've become so accustomed to it. They're so used to it. It's been this slow, gradual tightening that they don't even feel it. They're not aware the pain appears somewhere else.
So that tightening could have been from trauma or lack of the right minerals or movement.
Dehydration or all these other things,
yeah.
food sensitivities, all these different
those
factors.
things can cause. It seems like to me that it would be so worth it for people to find out and not have an operation, just think about having an operation, and not to stay on pain pills for years and years, because after a while they don't work anymore.
Right. I mean, if it's
Or you become a
possible to
junkie.
try something else,
Right.
you know, you can always go back and do the surgery, or always go back to
Yeah.
the pain meds if you still needed
If you
that.
have to,
Right.
you know, but yeah, find out first.
And that's another thing we
Preventative.
like to think about in naturopathic medicine. You can always do the surgery. You can always treat the pain. And in fact, there's a time and a place. I mean, thank goodness for, you know, thank goodness for surgery
Yeah.
and good surgeons. And thank goodness for the medications that we have today for pain.
Yes.
But from a naturopathic point of view, these things are overused because they're used as a first resort. This is speaking from our point of view. These
Right.
things are used as a first resort when they should be the last resort, when there are many other conservative measures that might be helpful before one has to resort to, in the two cases we mentioned, surgery or pain relief.
And the same things that are causing these types of pain, the same cause is going to be triggering other problems. So then people might develop high blood pressure or digestive issues or brain fog or other things that are all more symptoms of the same imbalance. And they end up seeing other specialists and getting on more medications because the initial problem isn't being addressed. You know, so you might come in for one thing, but you find all of these other things are being corrected. Does that make sense?
No, yeah.
Yeah.
It's true. I know someone who had, who was he was a motorcycle drag racer professionally, and you know, he got a lot of pain, falls and things like that. So he took a lot of over-the-counter Advil and things like that. And later in life, he got kidney problems. He actually got the kidney problems from doing that. So, like you said, it's not the first thing you do.
Right.
Well, it's well known in the way, it's well known to us, given the way we think about disease. When you treat the symptoms, which is what's done in our conventional society, as Dr. Wertkin just said in a different way, the underlying imbalance is still there. So something else is going to show up sooner or later. But also, when you treat the symptoms, all medications, I'll say that in English, all medications have side effects. Some of them are tolerable, some are less problematic than others, and some can be, what shall we say, borne for certain amounts of time. But the same thing over and over for long periods of time, something's got to give. These chemicals are not part of who we are. They don't belong in our body. The body has to work to get rid of them through the kidneys. So eventually we start to develop problems in our organs of elimination because the body's trying to get rid of this stuff. So anyone who's using any conventional medication for any length of time is hopefully warned about the side effects, because they're there. No matter how subtle or mild they seem to be, they're there, and they're going to continue to accumulate.
And I've read some side effects on some drugs. Say death is possible. Why would you want to put that in your mouth? Why would you want to swallow that? Oh.
I think some people don't realize they have any other options, and they're desperate. But I have that very same question. Maybe I don't really think that it'd be worth it.
Death is not an option for me. You know? Yeah, it's not an option no. All right, so now you're saying it's possible for it to be cured. We're not saying you can cure everyone, and so it is possible, and that's a great thing.
Well, let's be careful about what we mean by it.
Yeah, or arthritis, if they have arthritis. Yeah.
What we mean is the joint pain or inflammation, which is a symptom of something or a manifestation of something, can be eliminated if the underlying balance can be restored.
Right. Okay.
Okay. And there are people for whom there's too much damage or it's gone too far. There's always a point of no return.
Right.
So depending on how long something has gone on and how much damage has been done, I mean, logically there's going to be a point where it's nearly impossible to restore the normal function there.
Okay. But speaking of arthritis, which our show is about, there is a possibility, if it didn't go too far, that, like you said, you can build up that cartilage again and so forth. And
yep, so that damage can be reversed.
Right, and it's not just glucosamine or chondroitin. There's other things. Because I know that bothers a lot of people, too. It's like shellfish, taken from shellfish or something.
That's one of the main sources. So
yeah, and that's the shells, right?
Right.
And that bothers people's stomachs. And I took one that was taken from the way they fermented the corn and aspergillus, whatever, a fungus, a mold, which caused a horrible rash on my body. And
well, many people are very sensitive to mold.
Yeah, and I'm going, and I went to the doctor, he gave me some medicine, he said, you have a fungus infection, and it didn't help. And then I started looking at what I was taking this vegetarian source of glucosamine, and I emailed them and asked them, what is the source? It never says the source. Is any kind of mold or anything like that? I told him I had the rash. He says, oh, I'm not surprised. It's taken from this aspergillus. I said, oh, no wonder. I stopped. Rash totally went away. So that's something people have to look out for, too. You know?
Absolutely.
So now you say, how do you process it? What do you do? And this should be written down. It should be on the bottle. People shouldn't have to suffer that kind of thing, even with natural things.
Well, that's
you have
true.
to be careful.
That's true. And that brings us back to that question about quality products as well.
Right.
However, even with the quality products, we're not always aware of what's in there.
No, because I looked at other ones,
Right.
Even a good one, and I called them up, and they said vegetarian. I called, or I emailed, and they said, yeah, they were. That's how it was done.
Well, as you probably know, the supplement industry is not regulated.
Right.
And that's a whole show by itself, why it's not regulated.
But if it was regulated...
If it was regulated, it would legitimize it in the eyes of the public.
Right.
And that's the last thing that the dominant school of medicine and regulatory agencies want.
Okay.
They're not interested in having you use natural substances in place of drugs.
Right.
So they're not going to. So there's not going to be any regulation of these things until they become prescription.
Right.
Then they'll be regulated.
And then you can't get them.
Then you won't be able to get them unless you go to a medical doctor to have them prescribed. And how many medical doctors do you know that are conversant in biochemistry and nutritional physiology?
None.
Okay.
None. That's the problem.
So that's the politics of this, which is a whole other show.
Damned if you do and you're damned if you don't. It's
Yeah.
Yeah. Okay. So it can be slowed, and diet can affect it. And we talked about natural medicine and the symptoms. How about exercise? That's important, right? For arthritis. Okay. So what do you want to sum? We have about 10 minutes. And so, is there anything you'd like to say, you know, in summation to all this, or anything at all? Please, you have the floor.
Well, I'd like to go back to one of the questions that you
Sure.
asked early on, and we just skipped over because I kind of blew you off of it. Was about whether it was hereditary or not.
Oh, yeah.
This is a question that comes up with arthritis and other problems often. And in the naturopathic model, the answer is no. That doesn't mean that it's not maybe passed on in families or passed on to you from your parents, but it's not the arthritis that's passed on, because after all, the arthritis is not the problem. It's a manifestation or a symptom of something. It's a symptom of the kinds of things that we talked about. What's passed on to you genetically are your individual needs and your individual needs and your individual requirements for certain nutrients and for certain biochemical cofactors and so on and so forth. So if we go back to the mineral deficiency as one explanation for arthritis, my genetic makeup might be such that I require more calcium and more zinc than you do. I mean, we don't have the same kind of hair, we don't have the same kind of nose, we don't have the same shade of skin, so how come we both need the same amount of zinc or vitamin C? We are biochemically as individual as we are physically individual. So if my individual needs, which are determined by my genes, are not met, or for that matter, they're over amped or we're on the toxic side, but if my individual needs are not met by my personal environment, then I'm going to come up short on the calcium, magnesium, zinc, or other minerals that are involved here, and then I have those symptoms. But it wasn't the symptoms that I got from mom and dad, it was the extraordinary need for a nutrient, or maybe just a little higher need for the nutrient. So when things run in families, it's not just the genes, but it's also the lifestyle and the diet and so on. The environment.
Well, a lot of things now get blamed on genetics. You know, well, of course I have it because my mom had it, my grandmother had it, or whoever that is. But one of the things Dr. Sensenig is saying is what's affecting those genes are those same deficiencies that are getting passed on. Because your genes are not set in stone. They can be manipulated, your genes can be turned on or turned off by things like environment and diet and lifestyle. But if you have a zinc deficiency from your parents and that gets passed on and it's not corrected, well then you're going to start exhibiting signs of that deficiency even sooner. And then that will get passed on to the next generation. So that can be true of any of your vitamins or minerals or essential fatty acids.
So that would be hereditary then? That
that would
person
be
craves more
considered
zinc than other people?
Well, this is what's known, I know we don't have a lot of time, this is what's known
About 4 minutes.
in the vernacular as the genetotrophic theory. It's genetic, but it's not. Again, to maybe try to simplify this again, if my parents both had biochemical needs for zinc that are higher than the people who live next door, right? Then their children are going to have biochemical needs for zinc that are higher than the people next door. Yet if we're both eating the same thing, more or less, the typical American diet, my family's going to be short on zinc because I'm not getting enough for my needs, and then that'll manifest as a zinc deficiency. So what's being passed on are the nutritional requirements or the biochemical requirements, which then manifest as the imbalance that in this case we're calling arthritis. but that's true for all genetic diseases.
And the only way to find that out is to get tested. You have tests for minerals, right? You have for all that. And that's so, we never realize how important the right minerals are for a person.
And there we go back there in terms of closing. Exactly. We'll often see people who say, well, I'm taking calcium and magnesium. Mm-hmm. Or I'm taking this joint formula for my arthritis.
Right.
What's in there may not be what you need for your genetic makeup. And even if it is, back to what Dr. Wertkin was talking about, are you absorbing it?
Right.
It doesn't matter what's in the bottle, and it doesn't matter what's put in your mouth. If you can't absorb it, it's not helping you in any way. And that absorption is determined by your digestive function, the form of the stuff, whatever it is in the bottle, and your genetic makeup. So there's a lot of factors that go from the bottle to the joints.
Okay, well, do you want one last thought to leave? I think we've got just like 2 minutes left.
Well, one last thing that that we didn't get to talk about too much was about the exercise that you brought up. Mm-hmm. And it's a really basic thing, but so many people are not moving in their life. We tend to sit a lot, whether you're driving in the car, you're sitting at a desk. A lot of people notice stiffness first thing in the morning after you've been at rest. So even if you can start by just moving on a regular basis, obviously if you're having pain that's restricting you, we have to correct that first. But just incorporating regular exercise, it doesn't have to be aggressive. Mm-hmm. Doing stretching, having someone teach you some basic stretches can do wonders to help keep your joints lubricated and moving. And free of stiffness.
Is probably good for
Yoga's
that, right?
Excellent. Yep.
And walking is good, and so forth.
Yeah, you have to find the thing that you like, but something of that nature.
Okay.
There's so many things possible and available to help get people out of pain.
Well, I think this has been really interesting, and I think it's opened up a lot of people's eyes. It's opened up mine to understanding, and I'm sure our audience too, things that we never knew, really. So I thank you both for coming so much.
Thank you for having us.
So much,
Yeah,
you know.
thank you.
There's so many things going on in this world that we need to talk about, so I know that you'll both be back over and over. Okay, so we're going to give the audience your contact information. To contact Dr. Sensenig and Dr. Wertkin, they both are Natural Health Associates of Hamden, and the website is www.naturalhealthconnecticut.com, and the phone number is 203-230-2200. And to learn more information about this show or any of our past shows, please contact us at healingoutsidethebox@yahoo.com. Or to reach me, Rosemary Lachance, the phone number is 203-627-7966, or my website is www.rosemarylachance.com. Or to contact my colleague, Lisa Burton, her phone number is 203-804-0024, and her website is www.theonejoycenterforwellness.com. And we're on Healing Outside the Box. We're on Facebook under Healing Outside the Box. So take a look, and you'll see their pictures are there. Okay, the quote I'm going to read tonight is, "To laugh often and much, to win the respect of intelligent people and the affection of children, to leave the world a better place, to know even one life has breathed easier because you have lived. This is to have succeeded." And that's Ralph Waldo Emerson. Well, thank you so much.
Thank you again.
Thank you
again.
And good night out there. Good night.
Good night.
Okay.
Are we off the air?
Where dreams can be lost or found. As you look out through the window to the world you have made, always know you are the vision. See the truth, darkness fade.